Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, tuberculosis is a disease most commonly associated with the Victorian era, yet worldwide it kills more people than HIV and malaria put together. It's why the World Health Organization has set a target to reduce deaths from TB by 90% by 2035. Now, Britain, you might be surprised to hear, has the second highest rates in Western Europe. So what efforts are being made to combat the disease? Our health and social care correspondent Victoria MacDonald has been to find out.
4 times a day, Becky Curtis sends a video to staff at University College London Hospital, proof that she's taking her tablets.
So she will line all her tablets up to begin with so we can see what she's taking. Then she demonstrates what she's taking close to the camera. And after she swallows her tablets, she needs to open her mouth and stick out her tongue so we can see that the tablets are swallowed.
Becky has antibiotic-resistant TB, XDR, the hardest form of the disease to treat. Caught when she was sharing a house with others, but not picked up soon enough by her GP.
I was just living my life like any Londoner would do, going to work, spending time with my family. All of a sudden I felt as though I had flu, and I never ever once considered it could be TB.
This is part of a groundbreaking trial, Visually Observed Treatment, or VOT, so patients don't have to spend months on end in hospital. But this is also 21st century Britain, and this is a disease from the annals of history, yet very much still here. The World Health Organization wants to all but eradicate it by 2035. This is a big ask. In Newham, East London, a screening programme for latent TB, where there are no symptoms, picked up Enyart-Ula's infection.
When I come in GP, 2 or 3 times he checked my blood after, and he told me, you are TB, but don't worry, this virus is now not active, it's dead. So you take this medicine, after 3 months you will be okay.
TB is not actually a virus, it's bacterial, and it can lie dormant, activating for reasons not entirely understood.
We're looking to screen anyone who's spent more than 3 months in a high-risk country, that's a country with high rates of TB, in the last 5 years, and anyone also if they're between 16 and 35 years old. And once they're sitting down, they'll normally, when they join the practice, they have a health check anyway, and as part of that health check, we ask them if they want to be screened for TB, and the vast majority are more than happy to be screened.
The UK has the second highest levels of TB in Europe, just behind Portugal, and here in Newham they have the highest levels in the country, driven largely by the migrant population here, but also by social inequalities, by poverty, by poor nutrition, poor housing and exclusion. And while 73% of active TB cases are among the non-UK born, those numbers are falling. Studies show too that they're not spreading it. Where they are rising is among the homeless, those with alcohol and drug problems, and ex-prisoners, in other words, the excluded.
That 1/3 of the global population, we think, is infected with latent TB. And it's a bit like an iceberg. And so treating latent TB obviously prevents active TB from recurring. And because this is thought to, and there is a possibility that this is money saving, we actually have money from the NHS to roll out this program.
Next week, international experts will meet at the Union Lung Conference to discuss next steps to its eradication. But one of the hardest battles in fighting this disease is stigma.
People assume that you do come from, you've put yourself in that situation by leading a certain lifestyle. As I said, it's basically they assume you've been in prison or you do drugs or, it's not that type of disease. You could be anybody doing anything.
So even Becky, though prepared to talk to us, admits until now she hasn't told many others.
I've been getting away with it all.